And finally, what are other states doing? Exchanging best practices and talking to your peers in other states is a great way to understand best practices. In today's presentation, we tried to provide information from most geographic regions of the country that have initiated the RAC process. All in all, we're aware of the following RAC information from other states, and I'm going to summarize that right now. One Northwestern state issued a RAC procurement. Two Midwestern states issued RAC procurements. Both combined the RAC scope with other program integrity scopes of work. Two New England states have issued RAC or RAC-like procurements. At least 8 states will be leveraging existing program integrity contingency fee vendors as their RAC vendors and subsequently not be issuing separate procurements. This number continues to change and grow weekly. And lastly, one Mid-Atlantic state recently issued a RAC-like RFP. Well, this concludes this section of our presentation.
Thanks, Kim. Now we're going to take your questions. If you'd like to ask a question, please use the Send Question to Staff feature on your control panel. If you have trouble seeing your control panel, just click on that left arrow on your screen. We're just going to wait a few moments to allow people time to submit questions. Okay, the first question is for Kim. If state law requires vendors to be paid on a flat fee, does the CMS mandate override this law?
If a state is prohibited from using contingency fee contracts for RAC, they can fill out their state plan amendment, and they can actually note that in the state plan amendment, that they are going to seek an alternative method to pay the vendor, and they can get granted an exception from the contingency fee. They just have to indicate that very clearly in that SPA.
Thanks, Kim. The next question is for Kevin. What are some of the primary causes of overpayments to providers?
There are actually a lot of causes of overpayments, but probably the most common causes are really related to claims with TPL. So the coordination of benefits process really causes a lot of overpayments when you get into things like the coinsurance amount, the deductible amount. You'll see a lot of retroactive TPL identified. So a provider may submit a claim to the Medicaid agency, and then they find out after Medicaid has paid primary that the person actually has commercial insurance. So then they have to go and start the whole process over again. So the biggest issues are related to coordination of benefits. There are also some issues related to how providers process the claims. We see issues with retroactive charge adjustments. So a claim is submitted, say, for $10,000, and then the provider realizes they should have only submitted it for $8,000 or $12,000, and they resubmit that claim again. But far and away, the biggest issues are related to coordination of benefits.
Thank you. The next question is for Kim. Do you think CMS will require certain areas to be included in the scope of the RAC?
Because RAC is a state-directed program, CMS cannot technically require states to include any service, Medicaid service or waiver service in their RAC program. However, they are looking for states to demonstrate that they have all of those Medicaid services and waiver services covered, that they have audit programs in place. So if you aren't including a service, we are recommending that you attach some rationale, you attach a gap analysis that just indicates why you aren't, why you aren't asking for audits in that particular area.
Thank you. The next question is for Kevin. When does the 60-day rule go into effect?
It actually went into effect technically on March 23rd of 2010, but providers and state agencies are still waiting for clarification from CMS. And as we talked about, the biggest issue is how to define the term identified. When does that 60-day clock actually start ticking? But technically, it did take effect at the end of March.
Thank you. Another question we just received, and I'll take this one, is who can we contact if we have follow-up questions? If you have feedback or questions related to the webinar, you can write to webinars@hms.com. And if you have specific questions on the RAC or provider self-disclosures, you can feel free to contact me, and I'll make sure the right subject matter answers your question. And I can be reached at my email address is lkarian, spelled K-A-R-A-I-A-N, @hms.com. So again, either lkarian@hms.com or webinars@hms.com. Okay, that concludes our presentation. We hope today's presentation offered a clear understanding of how to better use the Affordable Care Act requirements to uncover opportunities for dealing with provider disclosure requirements and for detecting, recovering, and preventing errors in Medicaid billing and payment. Ultimately, we hope we've helped in furthering your state's efforts to fulfill the requirements of the Affordable Care Act and to help find ways to offset additional costs brought on by healthcare reform. Thank you again for joining us.